Thank you everyone for joining us today. Before we begin, I'm going to walk through a few WebEx basics. So everyone who is attending is muted, but you can still send questions and comments in the chat. The chat is the small chat icon bubble in the bottom right corner of your WebEx screen. If you have any technical problems during the event, you can send a question or comment to the host in your dropdown. And then all other questions and comments about the content can be sent to everyone. If your question is more private, you can send it to all panelists. As a reminder, this webinar is being recorded and we will share the recording afterwards. To access the audio, you can use your computer audio, which is preferred, or you can have WebEx call you if you need to step away from your computer. Lastly, there is live captioning available for this event. So to view or hide the captions, you can click the closed caption icon in the bottom left corner of the WebEx application for those to pop up on your screen, and you can click them to close at any time. I'm now going to pass this over to Ginger Pryor.
Thank you so much. Good morning and good afternoon, everyone, depending upon where you are in the world. I want to thank you for all of the places that you could be today. You decided to join us for what I believe is going to be an amazing conversation with a group of individuals who have given their lives to really serve children and families. And my desire for today is that this will be a discussion of what I'm going to say about hope. My favorite word is hope. And I choose that word because the very definition of hope is a feeling of expectation and desire for a certain thing to happen. And whenever I'm in the company of these individuals that I'm about to introduce to you, I have an expectation or a desire for something to happen, something positive to happen. So my goal today for this discussion is to spark an eternal and generational hope, and make sure that that hope reverberates to the children and families that we're called to serve. Really quickly, before I go through and just give a personal greeting to each of the guests who have joined us this morning and this afternoon. As I said, my name is Ginger Pryor. I have the privilege to work for APT Associates as a principal associate, and my role here is to develop the child and family well-being space so that we can continue to provide exceptional technical assistance and support across the country for those that serve children and families. And prior to that, I've spent almost 30 years of my life serving children and families through my service with Casey Family Programs, as well as my service at Los Angeles County and Georgia, the state of Georgia's child welfare system. So with that, just really quickly, I want to say thank you to Sandra, David, Mark, and Frank for joining me today to have this powerful discussion. Sandra has been a longtime friend and colleague of mine. We're Casey cousins. Sandra, of course, is the vice president with Annie E. Casey, but more than that, for me, she is a friend. She's a friend in hope. She is a friend who, anytime I call, takes up the mantle so that we can go out together and what we say, cause good trouble out for children and families. I've known her through my journey in Georgia. She's been with me through my journey in Los Angeles, and I'm grateful for her and grateful for her deciding to join us today to lend her voice to this conversation. So before I introduce the others, Sandra, I'm going to turn it over to you to tell us a little bit about yourself and that one word that describes you and why.
Thank you, Ginger, for having me. First of all, I really appreciate it, and it's good to be here with all the other panelists. I'm Sandra Gasca-Gonzalez, and I'm a vice president at the Annie E. Casey Foundation, and the unit that I oversee is called Center for Systems Innovation, which essentially means it's all of our work related to family well-being, which includes child welfare and prevention into involvement in the foster care system, as well as older youth transformation work in child welfare. The Jim Casey Youth Opportunities Initiative is one of the areas that I oversee. And then in addition to all of our family well-being work, I oversee our juvenile justice system transformation work. And it's just an honor to be here. And I would say that my one word, and that was a hard question, Ginger, for some reason. I don't know why I had to ask people. But the one word is connection, connector. And I see it in a couple of contexts. One is that for me, it means connection to purpose. And then in addition to that, connection to the voices of those who have experienced the system that know what needs to change firsthand. And then finally, it's connecting to other partners to find the win-win in their purpose. So that was my one word, Ginger. Thanks for the hard question.
Thanks, Sandra. And that is such a great word that describes you. You're definitely a connector in the full spirit of that word. You have connected me many times and you've kept me connected, even when this work gets hard, because it does. And so those connections are important. And the hope that fuels that is what keeps me in play to serve. So thank you so much. And I also know that you're doing double duty today. So I very much appreciate you.
Thank you.
The next person that we have is David Ambroz. David, another friend and colleague. I had the privilege of meeting David when I was serving in the great state of Georgia. At the time, David was shepherding Foster More and doing his great work with Disney. And I got to tell you, you'll see for yourself. And if you've read the book, hopefully you will feel the passion and so many other things that come from his book, A Place Called Home. But when I met him, I just immediately gravitated, towards him. There's something about his personality. You can feel the fact that he believes that things are possible. And when I met him and he asked for Georgia to sign on to Foster More, I was more than happy to walk alongside of him and do that. And who knew that at some point in time I'd be in Los Angeles, and he was in Los Angeles at the same time. And I will never forget when we were going through COVID, I called him and I needed his help. I asked for his help. There wasn't a hesitation. There wasn't, why do we have to do this? He immediately showed up with PPE and all of the things that we needed and my staff needed so that we could serve children and families. And that's just a small piece about David. There's so many more things. But David, thank you for taking the time to get on planes, trains, and automobiles and all of the things that are happening to you as you are going through this. So with that, David, I'll turn it over to you.
True story is I actually stole those from the set of Grey's Anatomy. So you had celebrity equipment. So David Ambroz, Scorpio, native New Yorker, Foster alum, relentlessly optimistic. I work at Amazon where I lead community engagement for the West United States. And that's a new job for me, relatively speaking. 1 year. I was with Disney for more than a decade. We don't want to talk about that. I'm an alum of foster care in a couple different states, but had a really long haul in the Commonwealth of Massachusetts. And I've been involved in tribal welfare reform since I was candidly born into homelessness, it feels like. But really when I got going around 14, being one of the young people that lobbied for Chafee. My one word is actually the phrase tattooed above my heart, which is illegitimi non carborundum, which means don't let the bastards grind you down. And I tattooed that on my body because I read it when I was about 13 in a group home in Margaret Atwood's The Handmaid's Tale. And I felt such a kindred spirit. So the bastard manifests in different ways. It could be challenges, work, seemingly impossible things, but you never give up. So that's why it's the most important phrase in my life. And I'm so excited to be talking to you all today.
Thank you so much, David. Again, I appreciate you and for your flexibility, because I know you're having to be very flexible right now. And I think that quote definitely embodies you, because there's never anything that I've ever put in front of you that you didn't want to take the time out to try to solve and move forward. So thank you so much for your time today. And next up, we have Mark Washington, another partner in crime. I have known Mark for many years now, also in Georgia. It seems like for me, all roads lead to Georgia. And so I met Mark. Some of you may know that Mark used to be the deputy commissioner in Georgia. And since the time that I started in Georgia, Mark was always leaning in to figure out ways how to serve. When I transitioned to Los Angeles, no other than I received a call from Mark Washington talking to me about how might we be able to work together to serve children and families. I've been on some amazing journeys with him about the power of our story and many other things. And so I was so glad to be able to call upon you today, Mark, and ask for you to join us. I think in this important conversation, you have an extraordinary level of passion for children and families, and it catches fire. Every time I talk with you and I hear you talk with others. And so with that, please formally introduce yourself and the one word that describes you.
Sure. Welcome, everybody. Thanks for joining in. I'm Mark Washington. As Ginger mentioned, we have been partners in crime. We have been in many a cell block together. I was a former state director in Georgia and in Kentucky, did some consulting work with the Annie E. Casey Foundation, and then really found the nice intersection of my prior experience before government was in healthcare, and then after government, continued to do some work in healthcare and technology, and now I sit in the space of Medicaid managed care, which is probably has the most potential for the best partnership in child welfare transformation of the next decade. And that, which is my key word, it's zealous partnership. All good things that I have done or been a part of or seen change as a result, whether it's with family, it's in relationship, it's at work, has been in partnership with others, where I've benefited from the sharing wisdom and developing trust and respect and building those plans together across sectors, across the fence, across the aisle, in terms of finding that 360 view, that total perspective, that all good things happen in partnership with a unified vision to serve somebody we've never met. So thanks, Ginger.
Awesome. Thank you, Mark. And again, that word definitely describes you. I mean, we can't do anything alone. And I think, this conversation today is going to be a reflection of the power of partnership. What we do by ourselves is one thing, but what we do as a collective and together can move mountains. So thank you so much, Mark, for joining us today. And of course, last but not least, Frank Alexander, who has been I've got a lot of partners in crime. I'm doing a lot of crime lately, but I've known Frank, for about 17 or so years now. I first met Frank when I was serving with Casey Family Programs, and I had the great privilege to go into his home state of Colorado and do permanency roundtables there. And that's where I met Frank. And, our story, the rest is history. We have remained colleagues and friends, and now I have the privilege of serving together with him at Apt Associates. And so with that, Frank, I'm going to turn it over to you to introduce yourself.
Thanks, Ginger. I appreciate it. And thanks for hosting us and facilitating us. And also just thanks to everybody who joined the call. We know you're all doing amazing work, and we just appreciate all the service that you're giving out in the world, especially over the last few years that have been, I know, really, really difficult personally and professionally for so many of our colleagues around the United States. My name is Frank Alexander. I'm Vice President of Systems Transformation here at Apt Associates, and I come here with about 30 years of direct service experience in community-based organizations and in government. My career started doing street outreach for individuals experiencing homelessness and running shelters for families that have experienced domestic violence and homelessness, and then moved into government and worked in the housing sector first. So I kind of came to child welfare through the domestic violence sheltering and housing systems. And I spent about 23 years in government running a housing authority. And we actually were in Colorado, one of the first agency in the United States to merge our housing authority into our social services department. So big focus on community integration, systems integration, social determinants of health, and really focusing on upstream prevention solutions. And so my word for today, it's hard going last when you can only pick one word, but my word for today is community. And the reason I picked community is that we all strive to be part of communities, more than one, many, concentric circles, circles that touch. And when any of us experiences crisis or dislocation or trauma or tragedy, our community connections shrink. And when systems shrink and they don't have connection to community and they don't center themselves in the voice of community and the voice of families, they end up not serving people well and not responding to people well. So I think we are all in the place where we need to build more love, more connection, more community, and to hold hands and support each other to do this hard work, because it's simply impossible to do if we don't actually center experience and love and community in the work that we do. So thanks for having me, Ginger.
Awesome. Thanks, Frank. And I think we are ready to rock and roll and get into this robust conversation. Again, thank you once more to each of you. Thank you for your words really of power and your phrases of power to connect. And as David would say, don't let the bastards get you down. And I think that that's really about perseverance and zealous partnerships and community. And with the recipe of all of these things, we can't help but to do good. To grind, as David says, and to do good for children and families. So let's kick it off with my very first question. My first question for y'all today is, it's a, me, I got to have a three-parter. So one, what is the greatest opportunity to transform child welfare? What is our greatest opportunity to transform child welfare? And what role will you play in doing that? And how does the word that you choose drive your contribution to changing the child welfare landscape? So I'm going to mix it up, and I am going to start with Mark.
I've benefited from being somebody who's both succeeded and failed at transforming child welfare. And when I strive for partnership with my Medicaid funder, I experience the greatest results. So, for example, having a joint planning approach to how you would design your Families First strategy, how you would design your alternative response approach, how you would rethink screenouts, can most effectively be done when you bring your Medicaid partner to the table and explore what does innovation look like for Medicaid funded services as a partner to child welfare. In the way you do case management, care coordination, and everything else. And so that is I think that is the greatest opportunity. That is the one that most of us have said, we've tried, it didn't work, they don't know us. Medicaid is saying the same thing about social services. And so now that we're both asking the same questions, let's come to the table and let's do the hard work of partnership.
Excellent. Thank you, Mark. And I'm just going to organically let y'all jump in and either add on to what Mark is saying, ditto that.
I'll layer in, but a breath mint. No one wants to smell that. So I come at it, I think, slightly differently, which is having worked in media for more than a decade. I find that very few social movements succeed without the public, because the job of an elected individual is to get reelected. And we forget that at our own peril. So we can be right, but we've learned how sometimes facts don't matter. So I have worked very hard through Foster More to just basically take foster care and adoption and the whole child welfare complex and take it along the journey like breast cancer, from an issue that few people talked about. And if it did, it was half the species problem, not the other half, to where it is today. How do we get foster care adoption and the kind of ensuing issues that wrap around that into the public's top 3 care list, which then will manifest in the way that they kind of vote, hopefully. So I've worked very hard to do that work, to rebrand the issue, because in my belief, if you don't tend the whole garden, nothing is going to thrive, no matter how righteous your individual program ideas are for solutions. So I have found that to be well received and accepted. And then the other mechanism is when we engage the public, it's to stop using any acronym or renaming things, which we are wont to do as a community. If we rename it, it'll defang it, but we take it away from common use language. So I speak like the public does. I talk about homeless people. I talk about foster parents, because that's what the public uses. And it's important to me to be with them, to bring them along on this journey. And the solution, I would say, and how it relates to my phrase, instead of an individual policy, it's going to be like a finger in the dike, we have to close our eyes and imagine the system as we would want to put our own child in it. And that's what I task the public. That's what I task legislators and my friends and family to do. And that's the system we need to build. That's the law that we need to pass. If we don't have that kind of comprehensive vision and version, I'm afraid that we'll be back here doing the same thing to fix the thing we thought would fix the thing, unless we do it holistically.
I agree with David that words matter 100%, and legislative issues are so important. I tend to look at our greatest opportunity to transform child welfare as prevention, but that in and of itself, that word is so loaded and it means a lot of different things to different people. So the way that I've been looking at that, the way the foundation has been targeting, through different populations, our kids in really taking a look at supporting young parents who are transitioning out of the foster care system without support. So those who are aging out of the system, specifically because they have had that experience of what it means to go through the system, feeling the fractures and the pain. And they, at the same time, have the greatest hope for wanting to have a different life for their own children and breaking those cycles. And so when I think about our greatest opportunity, I tend to look at that particular population for those reasons. And I think that we need to listen to the young parents about what it will take to make them successful. And that's a different kind of listening, not just listening to listen, but then how do we take what they say and support and lift up their voices in such a way that leads to those practice changes, those policy changes. And I know there's a lot of movement in centering lived experience, but I think we have to go to the next level and really start thinking about how to make sure those people are in positions to actually make the decisions, because there's only so much sharing of authority that people are willing to do. And it really will take people like David, others out there in the world that are actually that can take that experience and do something with it in a position of power. What I plan to do, what I'm going to be doing is I sit in a seat of privilege. It's not lost on me that, being in the role that I'm at, I can leverage this position to make sure that young people are not just young people, but that equity is centered in all the work that we do. You don't get a grant if you're not doing it. It's that simple. And how that all relates to the word that I used around being a connector, it just really describes to the description of making links to formal and informal solutions with likely and unlikely allies is the way that I see is our greatest opportunity to get there.
Yeah, fantastic comments. Just to add a couple of things, I think, in my experience working within and outside of the child welfare system, I think one of the things that's really characteristic of it is the fear that people have of it and the isolation that exists within it for the people that both work in it and the families that touch it. And I think that, child welfare, just like this last year, 20,000 children a day are referred to child welfare, 7.1 million kids. And very, very few of those children and families actually receive services. So we have an incredibly overwhelmed system that is incredibly isolated and misunderstood. And what we're really missing is an understanding of sort of the systemic factors and the system failures that are resulting in us overusing child welfare for everything that looks like a child protection issue, because we've basically criminalized poverty and we've exacerbated disparity in a system that is having a very difficult time functioning on a daily basis because of what's not understood, what's misunderstood, and the isolation that exists within the system. So I think where we really have an opportunity to support child and family well-being is in bridging to the community and bridging to community conditions and really understanding what every youth in foster care, every youth who's aging out of foster care, every family that's been referred to child welfare experiences and needs is just a sense of connection and access and support in a moment of crisis and dislocation. And a lot of that is connection to economic supports and community supports and access to opportunity. And I know we'll talk a lot about that, but I really feel like we need to call out in the most basic way the sense of community responsibility for family well-being and prosperity for all. That is really the North Star. And I think the more that we keep focusing on fixing the system in isolation, the less we actually will fix it.
Thank you for that, y'all. I think we could probably spend our entire time just really focusing on that one particular question in terms of transformation, and what we, hope to have happen in our greatest opportunity. When I think about the things that y'all have contributed to the first part of this conversation, I've always looked at it as a continuum, right? We have an opportunity to hopefully prevent first. We really should be doing the things that all of you talked about, connecting to community. I remember a conversation that I had with one of my colleagues in Georgia, and I'll never forget, she said to me, every time a child is born, we have an opportunity to get it right. And I've always felt that if we can look through the eyes of a child and imagine the life that we would want to have for our own child and the life that they would want to have, we have such an amazing opportunity to build the world we want. That's not about keeping children from protection, but it's about creating the world we want, preventing them from having to come into the system. If they must, then yes, we need to have a structure that helps to intervene, but intervention from the form of support so that ultimately we can get to a place of restoration of communities, restoration, of families, whether it's biological families or the families that we help to build and create together, because family looks so much different to each and every one of us on this call, as well as the millions of folks that live out in the world. Family has its own meaning and connotation, and how do we work together to create that sense of family, even if it's not in the same construct that we believe that family resides and sits. So I'm going to transition quickly to the next question. And that's, if we were successful in creating the conditions that mitigate further involvement into social serving systems, what will that look like for children and families and the communities with which they live in? And as you talk about it, and Sandra, you had touched on it lightly, talk about how each of you will advance equity in respective areas. So with that, I'm going to start with you, Sandra, in philanthropy. Then Frank will go to you. We'll go to Mark, and then we'll round that question out with David.
Okay, great. Yeah. At the foundation, we've been very focused on equity work for the last 10 years. It's not something that has been new in the rise of the recent racial reckoning. We've actually required that all grants provided have an explicit equity focus, and that people look at disaggregating the data, and not just the numbers, but also looking at the story behind the data, because as we all know, oftentimes the way that data is collected might have its own racial implicit or explicit bias. So it really is looking at the story behind the data too. And one example that I can, just to make that a little more salient, is our Thriving Families, Safer Children effort that we've been supporting, which centers building prevention ecosystems with community, by them actually designing what it is that they need. And I know Frank was at the ground level of starting this up, but basically it is really taking a look at all the disparities and the disproportionality and making sure that families have housing, food security, jobs, education, all the things that we all talk about, all the factors that affect families. And we at the foundation, even though it's a big partnership, and I won't get into all the details, we have a focus on youth and young adults. And the reason for that is because it includes young parents. And we take this very targeted focus around Who has the most vulnerabilities, but who also has the greatest opportunity? And that is what we believe to be young parents when we look at the data. So what that would look like actually is that there would be no housing waiting lists. When a family needs housing, they get housing. They're not hungry, they have food. They have income that they need to raise their family. For our older youth, we believe every young person deserves legal, permanent family of their choosing. I know that that's a whole other webinar in and of itself. But then also making sure that young people have access to free education through tuition waivers. And I know David's done a lot of work with Chafee, but all of that should not be an either or. They should get family, legal, permanent family, and they should also get the resources that they need to thrive. So when we look at equity, we really look at it as like who are the most vulnerable, but who have the greatest opportunity, and what does the data say they need, and how do we invest in organizations that know how to create the solutions. And it's typically not your everyday organization that we tend to lean on. It's the ones that haven't even come forth yet.
All right. And
Sandra?
before I do, I know David won't toot his horn, but I'm gonna. If you haven't read his new book, it's A Place Called Home, and it is a really important body of work. David, I want to thank you for writing it, and it was an honor to read it, honestly. And it just came out, so if you haven't had a chance, please pick it up. I think it's a really important thing for anyone who is doing anti-poverty work in addition to child welfare work. And I would say from the governmental perspective, there's a couple things that I want to add that I think David touched on quite a bit in his book, and that I think is the daily experience of people in government. People go into service to serve. They go in to support. They go in to make change. They go in to transform people's lives and to feel transformation in themselves. They go to make a difference, and as part of making a difference, to actually caring more. They know sort of in their inner heart that part of them is going to be healed in the process of supporting and changing. And then they often enter systems that aren't built to support that orientation. They are compliance driven, they are fear-based, they are overburdened and overwhelmed. And the capacity of the system to respond in the human sort of community-centered, equity-centered way is reduced. And then as that system sort of continues to operate in that way, each crisis sort of sends it further down that spiral. And it's very difficult to kind of rebuild and come out of that without tremendous effort, tremendous leadership, and tremendous support. And I think from a governmental perspective, I think we have to be very, very clear that that's what we're about, and that we need community connection and leadership to support that kind of transformation, because the people who are actually working in our systems with the right guidance and leadership and vision can actually build more community connection, support more families, create more love, and really do the reparative work and connection work that's necessary. But in overburdened and sort of broken systems, it becomes sort of a death spiral, and it's very difficult to get out of. And what you see, I've had the honor to work closely with or within juvenile justice, the correctional system, the housing and homelessness system, the hunger system, the Medicaid system, the child welfare system, child support systems. Disparities are endemic in every single system, and they are more endemic the deeper you get into a system. So basically what we've done in the United States is we swing high cost, deep end institutional responses to solvable problems upstream. And then we spend more and more money in a system that's driven by crisis, where people are not happy for the most part in those roles because of the system crises, and they can't function on a daily basis in the way that they need to achieve the stated outcomes of what they're there to do. And I think that's a governmental leadership role. And for folks that are in government, we need philanthropy and healthcare and community leaders and politicians and media support to change that narrative so that the systems can do what they're supposed to do.
Thank you, Frank. And I'm going to take a little moderator privilege here. So it's already 10:37. I cannot believe that much time is gone. So Mark, I'm going to have you get the last word on this question. And then on the next question, I'm going to focus that question on David and have David answer. And then David can kind of weave in his response on that next question. So Mark, I'm going to have you close us out on this one.
Sure. Yeah, in terms of prevention and on the topic of equity, which is near and dear to my heart, it's I believe from our position in the Medicaid managed care space, we have them from birth to grave, and these are our neighbors in every community, but you also have a very common vision of well-being for all. So what does that mean? At the point of birth, it does mean that we have an opportunity to lead the league in the lowest infant mortality in the world, not come in 22nd. And so how do we do so? There is great utilization and research around the employing Black doulas in the program. And that's a very specific thing that requires some policy change, requires some people to get over their fear of spending more to save lives and save dollars later. But yet, as a result, the problems that begins to cure is that you have folks that are the victims of interpersonal violence, and sometimes multi-generational. And Ginger, I've heard you speak to the 7th generation principle, and this is an opportunity for us to act now in a prevention, early intervention approach, and to rethink why not do more home visiting programs. It's going to save costs later, and it's going to position the children we serve better. But I think at the heart of that is utilizing and working with people with lived experiences. You have people in administration, people in leadership, people in charge who they need to be surrounded by those who have been there, done that. And it doesn't need to be researched. It doesn't need to be the product of some other 5-year grant. We know what to do if we just listen to those who have been there. And once we do that, then we not only can we deploy a plan that is right, but it's also real. So
thank you for that, Mark. And I have talked about the 7th generation principle a lot. For those who are not familiar with it, you can definitely Google it. The Iroquois talk about the fact that every decision that we make, be it governmental, personal, or what have you, has the ability to affect generations to come. And in the Lakota tribe and other tribes, they believe that a generation is 100 years. And in Western, it's 25. So imagine the decisions that we make now can reverberate in the lives of families for 700 years to come. So we can either make good decisions or we can make bad ones. And those of us who are social workers know that we're still talking and operating under the Elizabethan poor laws, right? From the 18th century of worthy and unworthy poor. That's how we look at people. I'm not going to give away the book because I think you need to really read it. But one of the things that it does slightly talk about is I was deeply impacted by David's mother's experience and how she knew how she had to navigate and show up in the system in order to get help. And I just think that that's a shame that we put people in a position where they have to navigate or share their story. They got to come in just right, in order to get, enough food stamps or in order to get enough, benefits, and they're not even enough to last the whole month. And I was extremely impacted, even though I know that in my mind. For me, I'm even greatly more impacted because David is a friend. And I think people make associations based on that. Sometimes things seem so far out here with people you don't know, but it becomes much more personal to you when you know that someone that you love and cared about their life trajectory has been impacted in such a way. And so with that, David, I'm going to turn this question over to you, and then we're going to move into the audience actually has lots of questions. So we're going to save the last 10 to 15 minutes trying to answer their questions. So the question and the last question that I have is, so David, in your book, there were lots of things that I could have chosen, but in the spirit of your book, it wasn't about like demonizing those that didn't do this and that. It was, you're telling your story and what happened, but you're also provoking people to act. Like, so what are you going to do like with all of this? And the quote from your book that resonated with me as it relates to that was this: not only that, they always seem to come when I need them most, when I'm hungriest or coldest. A hand comes forward, and with it comes more than relief for the suffering of the moment. There is a message in these kindnesses that tell me there's possibility for a better life. You matter, we care, you are worthy. Once I figured out these adults existed, I started keeping an eye out for them. While they are predisposed to be kind towards kids, I figured out how to motivate them from sympathy to action. When they ask me how I'm doing, I answer cleverly, well, I'm fine, thank you. I'd love to hear your opinion on the Iran-Contra affair, or do you think Governor Cuomo should run for governor or president? And being smart and witty seems to get me more attention and support from these angels. I chose that quote because it reminded me of Mr. Rogers when he said the quote of, when I'm afraid or scared, my mom always told me to look for the helpers. There's always people that are helping. And so I'm wondering, tell me and talk to the audience about what that quote meant to you and how has it shaped how you act today for children and families.
Oh my gosh, there's so much I want to say. First, we have the best foster care system in our nation's history right now. The most equitable, with the most transparency, doing some great work. And I start there because if we always scream fire, we have to pay people to run into fires. And the public doesn't want to run into fires. They want to know that there's hope, and I believe there's hope because the people that I have encountered, like my sister who's a social worker, like some of you, are doing the work. And so I didn't write my book to demonize anybody. I think a lot of times the public's interaction with this issue is not about the occasional angels that you talked about in that quote, but it's about a mistake or an oversight. And of course there's going to be, we're human, and this is a messy situation. So I always started the place of trying to develop empathy, not just for little David, but for my social workers who had not just the kids in their caseload, but every kid they saw when they walk into a house, every adult. So it was really important to me to emphasize our common humanity throughout this whole process. I talk about what you just shared because, poverty is never about the future. Poverty is about now. It has to be about now. Where's the next meal? Where am I staying? Am I going to be able to make rent? Is mom going to hit me? Is this foster parent okay? Or what is going to happen to me? It's now. And so it's not often you get to look up and out on the horizon and see. And so these adults, occasionally, almost like I was pulled out of the ocean on a lifeboat. I didn't stay long, but I breathed. And then I got dropped back in. But the breath was important and it was sustaining. And I'm grateful for it. And the people that did it don't even know the casual kindness and grace they provided me. But it changed the course of my life again and again and again at these key moments. You can perform to get more of that because we're all human. We don't want to help a kid that says F you or a parent that's difficult. So I learned I could get more. And the other part of that is to go into your equity question a little bit is I'm a cisgendered white guy. So I think there's an element throughout our system that we're reckoning with more now than when I was a kid around this topic and this issue. In line with this, Ginger, in the interest of time, I did a podcast yesterday with Human Rights Campaign's All Children, All Families initiative, which I was there at the birth of. And I was really part of a movement called the Joint Initiative with Lambda Legal and Child Welfare League to stop reimbursing states that were curing gay kids, like I went through. And I went to HRC and I was like, oh, 20% of the kids in care are queer. And they're like, it's 30. 30%. So when I think about equity, I can't talk about experiences that are not mine. I hope that my foster brothers and sisters, hundreds of them that I had, see me and benefit from my advocacy. But I can only talk about my experience. And part of the equity is the Native American child welfare issues, but also queer. We're overrepresented. We're barely thriving, never mind surviving. And I think there's an opportunity to focus equity more broadly as well. But we're wrestling with it. And I know we are. It could be better, faster, and more. But isn't that always the case? I share that quote because it's people like you. It's people like Bobby. It's people like my sister that came into my life and gave me a chance when no one else would. And I got to that PPE, not just because my sister was a social worker, but because social workers were overlooked. No one in LA, and I'm a mucky-muck in the city, was talking about social workers. My sister was detaining kids. I'm like, what is she wearing? So we have to put front and center and honor this profession and the commitment they do and all of us that support them. So I'm proud of the story I told. It doesn't negate the improvement I hope to see have happen. And I hope that answers your question.
It does, David. Thank you so much. As I said, I knew that an hour was just going to poke the bear, and there's so many questions and so many things that we can discuss. And my hope is that there will be other opportunities for us to continue this dialogue because it is in community. It is in connections. It is in partnerships. It is in the belief and the expectation and the desire for something to happen that we will be able to change the life trajectory for children and families that we're called to serve. So there are several questions. I'm going to try to get to some of the questions. And then for those that we don't answer, we've collected the questions and I will make sure to send them out to this esteemed panel that I have to get some of those reflections so that we can share it back out with the group. So one of the first questions that we have, and this can go to anyone, how can we shift the mentality of mandated reporters to being mandated supporters of families? Who wants to take it?
Wow. I'll chime in quickly. My sister, I once asked, she's a social worker. I said, what do you do? And she said, paperwork. I think if we want to hire paperwork processors, we should create that profession. Like in medical, there's people that transcribe doctor's notes. I think we should let social workers be social workers and do the important work they're trained to do. And that's something I think we could get out of their way and they could do that work, Ginger. Just a thought.
Thanks, David. I'll look to you, Frank. You've run systems. My reflection on that is in my last role in LA, that was one of the big conversations that we had with some of the communities about how do we shift to being mandated supporters. I think that, in practice and when we train, we can train people to be surveillors or investigators, always going out and providing heavy surveillance on families. Or we can train folks to talk and come from a perspective of what are the opportunities? That was what was said. How can we support this family? What are the things that this family needs so that we can mitigate their. I don't think that we train, our workers in that way. We train for them to look for something. Look for this, make sure you're looking for that. And if we're sending them out to look for, and we have a mentality of looking for the things that are going to remove a child, that's what we're going to look for and that's what we're going to find. But if we train to be supporters and we're going out of how can we help this family, how can we mitigate their involvement in this system, then that's what we're going to look for. And that's how we're going to show up. So that's kind of my, high level thought about how do we shift the way in which we're called to do this work. And quite frankly, as a social worker, and when I think about the code of ethics, the first code of ethics is service. We're called to serve families, not to surveil them. So Frank or Mark or Sandra, I don't know if one of y'all want to touch.
I'm happy to jump in here. I think anytime you put the word mandated in front of something, it just goes south. So I think it's about how you resource people in neighborhoods, in communities to actually be there for one another. And I would start with that, but I would also start with getting more specific about schools. Like when you look at the primary reporting entity, it's the school system. And I know the school system has their own set of issues, but I think that there's an opportunity there when I think about some of the work that Communities in Schools is doing with across the country, a large number of, they're focusing on what kids need when they're in school from the time they enter school to the time they graduate high school. And they're looking at expanding that to post-secondary education. And they have really good data about the outcomes that students and families are able to achieve as a result of their intervention. And I think that there's a fragmentation, this is just my opinion, of how schools lean on those kinds of resources because they're, focused on educating kids and they have, like I said, their own set of issues. So I think it comes back to connection, how to connect the resources, whether it's a mental health practitioner in the school with communities in school. There are a lot of resources there. And we can't rely on the teacher. The teachers actually don't want to make the report. Like, let's be clear about that. There are a lot of educators that don't want to make the report, but they're mandated. Again, they may not know where to find the resources. So I think it's a lot of like, how do we connect all these different resources that currently exist to target, the education system, because that's our biggest reporter.
Thank you, Sandra. Frank or Mark, before I transition, I'm going to try to get in 2 more questions.
I think those are great points. To my earlier comments, the child welfare system itself is full of screened out referrals and unsubstantiated cases that are associated with poverty and neglect. 76% of the cases last year in NCAN's report are neglect based. And what most mandatory reporters are experiencing is what Sandra said, the fear of not reporting and a lack of understanding of how to connect families and children to resources and supports. So I think for those that are really interested in how to do this, you've got to look hard at your neglect statutes, and you've got to look hard at your mandatory reporter trainings, and you've got to look hard at developing a strong alternative pathway to what families, children, and youth all want, which is access to opportunity and support. And those things are totally doable, and they support each other. And frankly, the child protection system for those cases that are truly physical or sexual abuse or significant abuse that requires an intervention, and there will be a lot more resources to be able to handle those more effectively if the system isn't bottlenecked with poverty and neglect.
Awesome. Thank y'all. So we have about 5 minutes, and this is sort of a big question. So I'll ask this one question, and then we'll close out. And I promise y'all that we will work to answer the other questions that were presented. And I want to thank the audience for really engaging and having these thought-provoking questions. So the last question that I'll end with is, what strategies work well to address community-level conditions? Are there any research resources you can link as well? Who wants to take that?
Big question with 4 minutes left.
I know. That's what I do.
So my thoughts immediately go back to the days and what over the course of more than a decade of Allegheny County and Mark Cherna and under his leadership and so forth. We were in the Urban Child Welfare League together, and there was much about that idea about resource and rethinking and bringing everybody to the table and doing the hard work in the beginning. that later led to a lot of services that fell under things like 4E waivers, Medicaid waivers, and so forth. So there have been instances where great work has been done, not on a state level basis, but on a local basis. I'd be curious what other folks' perspectives you may have.
Thanks, Mark. David, I think I saw you getting ready to chime in.
Oh my gosh, pregnant with thought. So I would just say we won't have healthy children if we don't have healthy families. We won't have healthy families if we don't have healthy communities. And this does not exist in isolation. How many of us have been to a local planning commission meeting where they're deciding whether or not they're going to update the health and welfare safety element to include access to green space? What? A huge determinant of health is outdoor recreation space. So I think the other part of the trouble for industrial community, we need to engage these other things because we can't keep working in isolation around these other public processes. And as the planning commissioner for Los Angeles, I can tell you, there were so many moments when we were doing action when I was able to center this community. Oh, that's not my flight. But I think it's important that we remember we need to tend the whole garden, and that is the public space. We have an obligation if we want thriving, healthy families to make sure that we're doing all the way back in the ecosystem. Part of prevention is not just wraparound services, it's what kind of built environment are folks living in, what kind of schools. I was struck to find out that not a single member of the school board where I live in LA has a kid in public school. I don't know if that matters, but I think it does. How many of us have been to a local school board meeting? They're awful. However, I do think we need to engage on all these different parts if we want to have the thriving kids that we want.
Thank you so much, David. So we've got 2 minutes left. If there's 1 minute that someone wants to take to have a last reflection before I get ready to close this out.
Go, Sandra.
I mean, my final words would only be, I was seeing in the chat that there's always discussion about the silos, and the need to break down the silos. And I always say that until we start looking at families holistically for their strengths, their value, and their ability to thrive, rather than through their legal status and the silos that they need to be served in, we're not going to make any progress. And so I would argue that we really need to check ourselves when it comes to whose job is it. It's everybody's job. We're all in these roles for different reasons. And it does, I'm not to keep, like sounding like a broken record, but it is about connection and engaging all those different silos that are put here to serve families and to help them thrive. So those would be my parting thoughts, Frank. I'll turn it back over to you because I'm sure you have some too.
Well, I know Ginger wants to wrap up, so I'll pass it to you, Ginger. I know we're almost out of time here.
Thank you, Frank. I just want to say thank you to each of you for, as I said, agreeing to give of your time. There's something that David works on called, give your spare change, and you all gave your time today, and that isn't lost on me because there's the greatest, resource that we have is the time that we give. There's no amount, a dollar amount that can't be put on the time that we have. And thank you. Donate your small talk. And, what I would say is that we have the greatest opportunity. I think David mentioned it earlier. We have the greatest opportunity right now in this moment to make significant change. And the seeds that we plant today, we may never see them come to fruition. We will plant them and they will create great shade for families that we may never experience or rest under, but we plant them nonetheless. And so let us be hopeful in the journey that we have forward. We can change the trajectory for children and families. We just have to keep the desire out in front of us of what would we want for our own families and why would we want any less for someone else's families. And so to the audience, I want to thank you for sharing of your time. Today, we will work to get your questions answered. You have our links, and we will also make sure that I think David has put some links in there with regard to his book and connections to our panelists. I appreciate y'all. Go out and make magic or mischief managed, as we would say. And again, thank you, Sandra. Thank you, Mark. Thank you, David. And thank you, Frank. I appreciate all of y'all. Have a great day.